Hello, my name is Gusti Adityawarnam with the student number 20025112115, and we're from small group discussion B7, and we would like to present to you our evidence-based medicine student project regarding scenario 7. And these are our members from small group discussion B7, starting off with the first one about epilepsy. So epilepsy is included as one of the common neurological disorders distinctively characterized by disturbance, particularly in the electrical activity aspect of the brain, caused by various factors. It covers a wide range of seizure kinds and intensities, as well as their semiology, etiology, effects, and treatment. Next up, we have the diagnosis. So a physician would typically diagnose epilepsy based on physical manifestations, symptoms, and the findings of the tests such as MRIs, CT or CAT scan, and EEG. Accurate diagnosis of the type of epilepsy and pattern of the seizures is especially crucial in ensuring a good prognosis.
Hello everyone, my name is Gusti Harmyta Satya Diksha with the digit of my name is 145. Today I will continue about the current management or treatment and prognosis in epilepsy. Epilepsy is a chronic disease that necessitates long-term treatment with anti-epileptic drugs. Anti-epileptic drugs are effective in some children. However, in some children, anti-epileptic drugs are ineffective due to resistance of AEDs. Approximately 60% of all children with epilepsy choose experience seizures after using the first treatment. This only occurs in roughly 10% of cases after switching to a new medicine. Despite treatment, over 30% of all children with epilepsy continue to experience seizures. Okay, that's all from me. Thank you.
Hello everyone, my name is Gloria Grace with last three digit number 162, and I'm going to explain about the shortcomings and risk factors of the current treatments. So there are two categories of anti-epileptic drugs, which are traditional drugs and newer drugs. Despite many options of drugs, most epileptologists prefer traditional AEDs. Prolonged AED use increases the risk of adverse events like drug interaction, cognitive dysfunction, behavioral changes, and thyroid disturbances. So clinical hypothyroidism, characterized by elevated thyroid stimulating hormone levels, can result from AED use, impacting kids' growth and development due to its influence on metabolism. These are the problems formulation and the objectives of the student project, and these are the benefits. That's all from me. Thank you.
Hello everyone, my name is Ni Made Yukta with the last three digit student number is 118. I would like to continue the presentation about the clinical scenario and also the clinical research questions of this student project. The clinical scenario of the evidence-based medical practice for this student project is patients with epilepsy are frequently required to take anti-epileptic drugs for a long period of time. Many studies have shown that anti-epileptic drugs have a negative influence on endocrine function, including the thyroid gland. However, the risk factors for the development of low thyroid function in these patients are unclear. As pediatrician, we want to determine the potential risk factors of low thyroid function in patients with epilepsy by searching for the best evidence. The clinical research questions of the scenario using PICO. So for the patient is patient with epilepsy, specifically children with epilepsy. For the intervention is newer anti-epileptic drug and traditional anti-epileptic drug. For the comparison is healthy children, and for the outcome is thyroid function determined by the level of serum FT4, FT3, and TSH. That's all from me. The presentation will be continued by my friend. Thank you.
Hello, my name is Ngurah Winata with 3-digit student education number 061. In this presentation, I will continue about clinical research question on the scenario using PICO. There are clinical research questions that we are formulate. Number 1, in children with epilepsy, does newer AED treatment increase the risk of having low thyroid function compared to healthy children? Number 2, in children with epilepsy, does traditional AED treatment increase the risk of having low thyroid function compared to healthy children? Number 3, in children with epilepsy, does newer AED have a different impact on FT4 serum thyroid level than traditional AED. Number 4, in children with epilepsy, does newer AED have a different impact on FT3 serum thyroid level than traditional AED? Number 5, in children with epilepsy, does newer AED have a different impact on TSH level than traditional AED? And last, number 6, in children with epilepsy, does choosing a newer AED have a significant clinically important difference from thyroid serum level than traditional AED? That's all for my presentation. Thank you.
Hello everyone, my name is Mita with last 3 student number 111. I'm going to continue about the critical appraisal of this journal, which is the validating aspect. As we can see here, the first one is study focus and design. This journal investigates traditional versus newer AED's impact on thyroid function in pediatric epilepsy. As we can see here, the study design is cross-sectional with 80 participants, ensuring internal validity through inclusion criteria and a matched control group. The second one is methodological rigor and ethics. As we can see here, the rigorous data collection and analysis adhering to ethical guidelines, and the aseptic blood samples collected, ethical protocols follow. And the third one is findings and recommendation. We can see the journal is statistically supported results presented with clarity, and it identifies subclinical hypothyroidism, which concludes a higher prevalence in traditional AEDs. And lastly, it advocates for a larger scale research, which acknowledges limitations and suggests diverse replication for broader impact.
Hello, my name is Putu Frastika Sari with 3-digit last number 052. Today I will continue about the important aspect. Compared with the control group, children treated with traditional anti-epileptic drug showed a significant decrease in FT4 and increase in TSH. However, newer AED didn't show a significant changes in the serum concentration of FT3 and FT4 and also TSH. Significant difference in serum FT4 and TSH concentration also seen between the group receiving traditional AEDs and the newer AED. Regarding the prevalence of subclinical hypothyroidism, there was a significant difference with traditional AEDs and the control group. However, there was no significant difference between the newer AED and the control group. Based on this result, if you from the aspect of importance, it can be said that the research saw a significant effect on thyroid hormone profile due to the use of traditional AEDs compared to the newer AEDs.
Everyone, my name is Dewa Ningsih with last 3 digit of student number is 105, and I'm going to continue the presentations with the applicable aspect of critical appraisal. So from the study, it is found that traditional long-term anti-epileptic drugs consisting of valproate, carbamazepine, and phenobarbital had a significant effect in reducing the serum levels of FT4 and significantly increasing the TSH concentrations compared to the newer anti-epileptic drugs. So based on this result, the use of long-term anti-epileptic drugs therapy, the newer one, are better tolerated by the patients due to their monotherapy nature, absence of serum drug monitoring, few drug interactions, and also potential neuroprotective effects. So besides that, it is also crucial to consider the perspective of children, parents, and also caregiver in terms of values and views. In the administrations of epilepsy therapy, especially long-term therapy, patients are more easily managed with monotherapy using newer anti-epileptic drugs compared to the polytherapy with traditional anti-epileptic drugs. However, the monotherapy or polytherapy may still increase the risk of adverse events such as drug interactions, cognitive dysfunctions, behavioral change, and also metabolic or endocrine disturbance. So based on the risk of endocrine disturbance, it is recommended to screen the thyroid hormone profiles to prevent complications arising from thyroid dysfunctions. So due to the small sample size and potential variations in individual response to medications, further comprehensive research is necessary to apply these findings and establish a clearer cause and effect relationship between anti-epileptic drugs and thyroid dysfunctions in these populations. Maybe that's all from me. May be continued by my friend.
Hello, my name is Ni Made Yukta with the last 3 digits to the number 143. I'm going to explain about the results and discussion. Question number 1. In children with epilepsy, does newer anti-epileptic drug treatment increase the risk of having low thyroid function compared to healthy children? Administration of various anti-epileptic drugs has been linked to thyroid dysfunction. In investigation involving 8 epileptic children, it was discovered that when compared to the control group, the serum concentration of FT3, FT4, and TSH did not significantly alter in epileptic children receiving newer anti-epileptic drugs. Therefore, newer anti-epileptic drugs treatment does not increase the risk of having low thyroid function in children with epilepsy compared to healthy children. Question number 2. In children with epilepsy, does traditional anti-epileptic drug treatment increase the risk of having low thyroid function compared to healthy children? In this study, it was discovered that those receiving traditional anti-epileptic drug treatment for their epilepsy had significantly higher TSH concentration and significantly lower serum levels of FT4 relative to the control group. It is demonstrated that children with epilepsy receiving traditional medication have a noticeably higher prevalence of subclinical hypothyroidism. Therefore, compared to children without epilepsy, children receiving traditional anti-epileptic drug treatment do have a higher chance of having low thyroid function. Next.
Hello, my name is Gusti Frangipani Vedanti with the 3 last digit of student identification number is 064. Today I'd like to continue the presentation to answer the clinical research question number 3 and number 4. Question number 3. In children with epilepsy, does newer anti-epileptic drugs have a different impact on FT4 serum thyroid level than traditional AED? Newer AEDs have a different effect on FT4 serum thyroid level in children with epilepsy. Children with epilepsy who treated with traditional AEDs show significant reduction in serum level of FT4. On the other hand, children with epilepsy who treated with newer AEDs didn't show significant changes in serum level of FT4. Question number 4. In children with epilepsy, does newer AED have a different impact on FT3 serum thyroid level than traditional AED? In epileptic children, newer AEDs have no different effect on FT3 serum thyroid level than traditional AEDs. Children with epilepsy who treated with traditional AEDs didn't show statistically significant changes on FT3 serum. Children with epilepsy who treated with newer AEDs also didn't show significant changes on FT3 serum. That's all from me. The presentation will continue by my friend. Thank you.
Okay, so before I continue the presentation, let me introduce myself. My name is Gusti Pradnyani with 3-digit identity number 044. So now let's move on to question number 5. In children with epilepsy, does newer AED have a different impact on TSH level than the traditional AED? The answer is newer AED have been discovered to have a different influence on TSH level in children with epilepsy than the classic AED. Children with epilepsy treated with traditional AED had significant increase in TSH concentration compared to the control group. However, children treated with newer AED did not exhibit any significant change in TSH concentration. This study compared the effect traditional and newer AED on the thyroid hormone profile of children with epilepsy. This shows that newer AED have a different effect on TSH level in epileptic youngster than the classic AED. Moving on to the question number 6. In children with epilepsy, does choosing a newer AED have significant clinical importance different from the thyroid serum level than the traditional AED? The answer is when compared to the standard AED, using the newer AED in children with epilepsy have been proven to have substantial clinical value in terms of thyroid serum levels. This study compared the effect of traditional and newer AED on the thyroid hormone profile in children with epilepsy. This shows that as compared to the standard AED, using the newer one may have a distinct effect on thyroid blood level in children with epilepsy. That's all for this part, and the presentation will be continued by my friends.
Thank you. Hello everyone, my name is Huliana Lim with student ID number 2002511080. Now I'd like to continue the presentation about the conclusion. In conclusion, the evidence-based medicine of this project's clinical scenario highlighted 4 points. We know that the anti-epileptic drugs has an impact on thyroid function. The study showed that the traditional AEDs in children with epilepsy show a higher risk of low thyroid function marked by elevated TSH and decrease of FT4 levels. Meanwhile, the newer AEDs exhibit a more favorable impact on thyroid function, suggesting potential benefit in managing pediatric epilepsy with reduced risk of adverse effect. And this study underscored the clinical importance of choosing newer AEDs, emphasizing their potential value in mitigating the risk of thyroid dysfunction in children with epilepsy compared to traditional AEDs. The evidence support integrating newer AEDs into pediatric epilepsy treatment with a call for regular monitoring of thyroid hormone levels, especially for long-term AED use, to prevent and to manage the thyroid dysfunction in patients with epilepsy. Okay, I think that's it for the conclusion. Next is, this is the references that we use in the student project. And I guess that's all our presentation of the student project. Thanks for all your attention. Thank you and goodbye.